today, well, I think a lot of people are really waiting for the wave 2 of the results that are coming out of the NIDS-CRAM study. But today I'm going to be presenting a paper that was based largely on the first wave of the data. And in the next 2 to 3 weeks, there will be updates on a lot of the work that is coming out. Let me just share my screen. All right, are you able to see household resource flows?
Yes.
Right. So the title of this paper is called Household Resource Flows and Food Poverty During South Africa's Lockdown, Short-Term Implications for 3 Channels of Social Protection. This paper was co-authored with colleagues Leila Patel, as well as Sofas van der Berg and Bokang Mampeta. And so I just acknowledge their contributions here. I think it's important just to highlight there were many other papers that were produced for the NIDS-CRAM study. And I think that the real value of this work comes when one pulls together the different findings across different papers. The work that I have produced really sat within a larger set of hunger and welfare papers, and I draw your attention to some others. So the paper by Sofas van der Berg, Linda Zuza, and Grace Bridgman on the impact of the coronavirus and lockdown on children's welfare in South Africa, and particularly drawing on the hunger data that's in the data set. And then much of the work around the labour market and poverty impacts obviously have a strong bearing on what's happening in households. And there, the paper by Ronik Jain and colleagues, as well as the gender effects of the COVID-19 crisis on households by Daniela Casale and Dori Posel was also worth mentioning. In this particular paper, however, I start off with the following really framework in which to situate the findings. And that is drawing on this work by Gerard Invert and Kate Orkin, that really identified at the beginning of lockdown that there were 3 options available to governments, particularly in developing countries, in the short term, to mitigate the socioeconomic consequences of the virus. And the first was to expand the social insurance system for parts of the labour force. So in our case, that being the implementation of TERS for the UIF system, and the implementation of UIF in general. The building on of existing social assistance programs, such as our program of grants. And then the third channel that was available to them was to involve local governments and non-state institutions to reach vulnerable groups. And certainly South Africa's 500 billion rand fiscal relief package incorporated elements of all of those 3 options. And I think at the time of writing, our sense was that both government and the social sector, their response had certainly been commendable. Nevertheless, households were really experiencing great hardship as a consequence of the lockdown. And even quite recent months, this is quite evident from the data that's emerging from NIDS-CRAM. So really the objective of this paper was threefold. The first was to explore how household resource flows have been affected from April to June, and specifically in relation to the pre-lockdown situation. Then I wanted to provide preliminary evidence on whether income shocks have exacerbated food poverty in households. And then thirdly, we wanted to consider the reach and the depth of localized social relief efforts. So going back to the framework that I presented, the third part of the options available to governments in reaching households. This is, while we draw heavily on the NIDS-CRAM telephonic survey, as well as general household survey data to get a sense of the pre-crisis situation. This really was a mixed methods paper, and we complemented our findings with insights from key informant interviews, which were largely conducted by Leila Patel and her team at the CDSA. And these were key informant interviews with social relief organizations involved in the food distribution. And the reason why this was really necessary was at the time, I think the results that were coming out of the data were so alarming that for us, we really wanted to see whether get a sense check on the ground as to whether this data really held in reality. And then in this particular presentation, I would also just like to draw on one or two results from the paper by Van der Berg, Suzanne Bridgman, because they very much are complementary papers, where they explore historical trends in child hunger, childhood hunger in 2020 due to lockdown, and how this has been affected by lost incomes. And then they again also draw on similar data. So first of all, what is the data? I'm sure you've all heard about the study. NIDS-CRAM stands for the National Income Dynamics Study Coronavirus Rapid Mobile Survey. And this really was drawn, the benefit of this data was that we were able to use the NIDS 2017 sampling frame from which to draw batches to execute this telephonic survey. The final sample that we managed to get was 7,073 individuals who were interviewed between the 7th of May to the 27th of June 2020. And that time period coincided with stages 4, 3, and the advanced level 3. In the top of this particular slide, I show you the breakdown of the responses and by the interview date, whether it fell into level 4, level 3, or advanced level 3 of the lockdown. And I think it's worth noting that we had high response rates relative to other telephonic surveys internationally. Generally, so ours was about 40%. So of the sample that was the batch sample, we were able to get 40, for every 100 interviews, we got 40 successful, every 100 potential interviews, we got 40 successful interviews. And this might seem low relative to what you would normally get with face-to-face, but it's actually very high internationally when one considers other telephonic surveys. Just to acknowledge, the NIDS played a really important role in providing oversight of the implementation of the survey. But there was a large multidisciplinary team. It was multi-organizational, and all of this was done over Zoom in a very short space of time to coordinate people. It's worth noting that there was a very quick turnaround from conceptualization of the study to implementation. And so you get these trade-offs between having data right now and then honing the design and testing for reliability and accuracy. But at the time, we felt like getting data quickly was the most important part of this. And so, yes, there will be concerns around reliability and issues that emerge. Nevertheless, we needed data, we needed it pronto. And so that really was prioritized. Although there was testing that was done, significant, at least 2 to 3 rounds of translation and testing before the survey was implemented. So really at the end of it all, we land up with a data set that is broadly representative of individuals 15 years or older in South Africa in 2017. So that should be 15 years or older in South Africa in 2017. I think the first important point to make from this paper that was necessary to be able to communicate to both the public and to government is that many grant receiving households in South Africa were reliant on other sources of income before the crisis. And so while the relief with respect to top-up grants that have been provided has been really notable, a large proportion of grant receiving households were dependent on employment income or business income. So if you use the GHS survey from 2018, 3/4 of grant receiving households were getting income from sources other than grants, such as income from employment or businesses or remittances. And for 44% of grant receiving households, sources of income from earnings were their main source of household income. And so the possibility of a job loss or a downturn in business really presented a major threat to the livelihoods of a large portion of grant receiving households. In other words, they were not immune to the income shocks that would be imposed by the lockdown, despite the provision of top-ups. We asked a question in the survey. And since the lockdown started on the 27th of March, has this household lost its main source of income? 2 of every 5 adults reported that this had occurred. And what's interesting is that the reporting of lost income really didn't differ very much by whether you lived in a non-grant receiving household or a grant receiving household. In fact, 42% of the respondents that were from grant receiving households reported that they had lost their main source of income since the lockdown had started. And again, I reiterate, the time of the interviews was between May and June this year. One thing that's really a great aspect of NIDS-CRAN is that we are able to use retrospective data, but also the NIDS data from 2017 as kind of like baseline indicators for the household in which the person resides. Assuming that individuals were living in the same household that they were in 2017, I used the income data for households from 2017 and produced quintiles of income, and then split this by whether the individual was currently living in a grant receiving household or a non-grant receiving household. And then look at this question again pertaining to having lost the main source of income. As you can see, the confidence intervals are evidently quite large for parts of this, but I think a clear pattern does emerge. When you look at non-grant receiving households, it appears that the poorest non-grant receiving households have been the hardest hit by household income shocks. 54% of those that were in the poorest quintile of households reported that they had lost their main source of household income since the lockdown began, compared to 26% of respondents in the wealthiest quintile of households. Lost income, though, however, the distribution seemed to be quite equivalent for individuals in grant receiving households across the income distribution. In a paper by Tim Koilat and Haroon Borat that also accompanied the release of the NIDS-CRAN results, I think they had a look at social grants, but their perspective was looking at social grants but in relation to individuals that were in the labour market. And what they find is that social grants are an important source of income relief for individuals in low-income households. And they show that these individuals have been disproportionately burdened by adverse labour market effects induced by the lockdown with respect to employment losses, the likelihood of having a paid job to return to, and reductions in hours and earnings. And so when you really look at the other papers that look at labour market disruptions, and particularly both permanent and temporary job losses, across all of those papers, there's one consistent finding that is emerging, that the poorest have been the hardest hit, that there's been extreme inequality with respect to how the lockdown has impacted on households. And so really, again, it pertains to this issue of grant receiving households really have been significantly impacted with respect to job losses, and this has impacted on their household income. Now moving on to food poverty. I think one of the challenges with thinking about hunger now is that you have to consider it in relation to a pre-crisis food insecurity situation. And certainly food poverty was a problem before the lockdown. That said, the child support grant and the old age pensions have been really important for boosting incomes and contributing to declines in poverty and hunger in post-apartheid South Africa. So this particular figure over here, which I have drawn from Safas and colleagues' paper on child hunger, shows you child hunger rates from the GHS from 2002 to 2018. And what is evident is that we saw generally there's been a significant decline from about 35% of children of children being reported as going hungry in the household to around 15% by 2018. Although you do see a slight increase in hunger around the financial crisis of 2008. Nevertheless, despite this decline and the really important social policies that have been put in place to address hunger, grants have, even pre-crisis, grants were certainly insufficiently large to meet required food needs and eradicate hunger in beneficiary households. And if one follows really some of the recent research that's come out, the top-up amount to the child support grant, when it was initially given per child rather than per caregiver, was actually almost exactly the right amount that you need to be able to, per child, to be able to give them a nutritious food supply for a month. Another really blatant and obvious fact pre-crisis is that access to employment income mitigated the likelihood of food poverty, even in grant-receiving households. So this table, this figure over here, disaggregates households by whether there's a receipt of a grant and non-receipt of a grant, and then whether there's any employed person in that household. And the indicators for food security are whether the household ran out of money to buy food in the past 12 months, running out of money to buy food for 5 days in the past 30 days, skipping any meals during the past 12 days, and skipping any meals 5 days of the past 30 days. And what is evident is that you can clearly see that regardless of whether you're in a grant-receiving household or a non-grant-receiving household, if there is a person that is employed in the household, rates of hunger across all these indicators are lower. Well, what happened now to food poverty as a result of the lockdown? Across our own study, and then corroborated with the study by Van der Berg et al., we are able to look at, compare kind of rates of hunger that were reported in either April or between May and June, with what was revealed in the General Household Survey of 2018. So first of all, we asked a question around, has this household run out of money to buy food in the month of April? And 47% of our respondents reported that this was so. The household had run out of money to buy food in April. And trying to kind of peg this to what was a reality before the crisis, if you use the GHS, the level of reporting is slightly different because it's at the level of the household. But here, 21% of households report running out of money to buy food in the past 12 months. With respect to hunger, 22% of our respondents reported that someone in the household went hungry in the last 7 days. So that would have been some point between May and June this year. If we compare that to the GHS, here the time frame is much wider, and so really this is, when you compare the difference between these two, it actually would be significantly larger if they were using the same reporting period of in the past 7 days. Here it's in the past 12 months. And here 14% of households reported that either an adult or a child went hungry in the past 12 months. Moving on to child hunger, 15% of our respondents reported that a child went hungry in the last 7 days. Assuming that we can use kind of the depth of hunger in the household, or the frequency of hunger in the household, and say, well, if you reported that a child is always hungry or hungry for 3 or 4 more days in the week, we said, well, this is probably a good conversion rate to in the past 7 days. And here, about 8% of households reported that the child went hungry in the past 7 days, suggesting about a doubling of the reporting of child hunger rates. Something that's really been interesting in the NIDS-CRAM study is that we find that adults appear to be shielding children from hunger. In other words, they will go hungry so that a child doesn't have to go hungry. But that this ability to shield declines with the extent of household hunger. And the mechanisms available for really staving off hunger are likely potentially to be borrowing or drawing on savings, and these mechanisms can only function for a short period of time, and eventually they will no longer be available to people if they have really exhausted their possibilities for drawing on other income sources or the help of neighbors and friends. Interestingly, we didn't see in 2018 GHS this evidence of shielding between adults and children. I just want to draw your attention to this figure, I think, because it really highlights the alarming situation around child hunger that we have to address. We've potentially lost almost 2 decades in this country with respect to addressing child hunger. If you take the rates of hunger now and implied from the NIDS-CRAM study at about 15% of children going hungry, this takes us back to about 2004, and that would be a Khan situation. I think that if anything, it might be more severe in terms of what's been lost in terms of time because of the conversion weighting method that was applied. And then what about looking at the severity of hunger? I think that's also useful to note that about 4% of our respondents said that a child had gone hungry almost every day or every day. 7% said that a child or an adult went hungry almost every day or almost every day or every day. One thing we weren't able to really tease out in the NIDS-CRAM study from wave 1, which we are hoping to be able to address to some extent with the wave 2 data that's coming out, is to see to what extent the impacts of the suspension of the National School Nutrition Program we're having on augmenting child hunger rates. So I think it's worth noting that about 9.6 million children, which represents 80% of all children in this country, were getting at least one meal at school prior to the lockdown. And virtually this completely came to an absolute standstill during the lockdown. The meals that are served at school really equate to about 80 Rand per month per child. This is that is about 20% of what the child support grant amount is prior to the introduction of top-ups at 440 Rand. So this is really sizable, and it was implorable that this situation occurred and that it took so long for the National School Nutrition Program to be reinstated. It required a number of legal cases for this to eventually get back into action. So really, with respect to hunger, it's been quite clear from our data that far too many people and far too many children are going hungry. And this really was really supported by our interviews with key informants. I won't draw on or reflect on too much of that in this particular presentation, but I really draw your attention to one particular quote from a humanitarian organization that we interviewed, who said that they've never had such demand before for food. During the lockdown, they received 8,000 emails per day and a large volume of phone calls at our call center, all for food relief. Besides the poor, we have never seen this number of requests for food aid from middle income groups. What has been evident from the data is that income losses are really are a major driver of higher food poverty. So I run these not particularly fancy models, but this is just we ran some linear regression models, and after controlling for food poverty pre-exposure factors, individuals and households that lost its main source of income since the lockdown started were about 12 percentage points more likely to report that someone went hungry in the past 7 days, compared to those that didn't report losing household income. And also particularly important finding is that particularly hard hit are households that were relying on money from friends and family, but that income source had ceased. Over 60% of adults in those households that were relying solely on money from friends and family reported that someone went hungry in the past 7 days. And these figures over here show you particularly the estimated hunger rates in households in the past 7 days. So that would have been between May and June, after including all these pre-exposure factors to food poverty as controls. And one can see really how much higher reported hunger rates are if the individual indicated that the household had lost its main income source. And this particular figure here, I've particularly tried to show you how this might differ by whether the household neither gets any social relief or neither gets any grants, and then whether they get grants or some kind of social relief for food or shelter. And I think what's particularly useful, and I draw your attention to this in the next few slides, is how significantly high child hunger rates were in households that were getting both grants and social relief and had lost their main source of income. So moving on to social relief efforts in particular. So in the midst of poverty, what has been the extent of the reach of social relief efforts? So we asked in wave 1, we asked respondents since the lockdown started, have you received support for food or shelter from the following sources: from government, from NGOs, churches or associations, from neighbours or the community? And what we found that is 8% of respondents indicated that they had received external support, so for food or shelter from government. 6% indicated they received support or shelter from NGOs, churches or associations. 9% indicated that they received food or shelter from their neighbours or the community, and 18% were reported receiving some kind of support from any of those three sources. And I think these are likely to have been really important sources of relief for households in improving the depth of support to households in need. Then we were also able to look at where did the social relief efforts, particularly around food relief, where did this go to? Who got this social relief? And so I had a look at, well, let's have a look at whether an individual is in a household that receives a grant, and then do they also get access to some kind of social relief, whether from government, NGOs, neighbours or the community in the past, since the lockdown began. And interestingly, so 53% of the respondents were just in a household that received grants. 30% were getting neither grants nor social relief. 13% were getting grants and social relief, and just 4% or 5% were getting social relief only. But it comes down to this point of 3/4 of those that were getting social relief, so additional food parcels, for example, were in households that were already getting access to grants. This was a major issue for, at the time, for NGOs and for the Department of Social Development, because they were trying to ensure targeting to households that got nothing and that weren't getting grants. But actually, what we seem to find in the data is that the doubling up of the social assistance with relief to the same households is not necessarily a misallocation of resources, because those particular households were identified as being particularly food poor and reporting that significantly higher rates of hunger. And I show this over here. So I split up these food indicators of food security by whether you're getting grants in the household and social relief, or the various combinations of what that could be. And what's evident is that households were significantly more likely to run out of money to buy food in April if they were receiving grants or social relief. But this was particularly more prominent for households that were getting grants and social relief. Reporting of anyone going hungry in the last 7 days. Here we see slightly higher reporting of anyone going hungry in the household if they were getting both grants and social relief. This seems counterintuitive, because one would expect that social relief would reduce your likelihood of hunger. But nevertheless, these were obviously extremely food poor contexts. And in the last panel here, one can particularly see that child hunger was particularly pronounced in those households that were getting grants and were targeted with social relief. So what this seems to indicate is that potentially this provision of social relief was actually quite well targeted, that in fact it was getting to the most food poor and to children particularly that were going hungry. So 1/4 of children were reported as going hungry. A 1/4 of respondents reported that a child had gone hungry in the last 7 days in households that received both grants and were targeted with social relief efforts. And so we really tried to communicate to the Department of Social Development that actually this is not necessarily a waste, that the doubling up of the social assistance and social relief to the same households was not necessarily a misallocation of resources at all. And so really, kind of the key conclusion of all of this is that we really need to stay off mass chronic hunger, and we cannot bet up on the support being provided to households through 3 channels of social protection simultaneously. We really need to think about how we sustain and broaden financial and administrative capacity to provide short-term social insurance, social assistance, such as social grants and localized community social relief. This is an urgent national priority, and we've evidently seen an emerging humanitarian crisis during the lockdown, and this would hamper economic recovery and threaten socio-political stability if we do not keep up with addressing what is going on for households with respect to just the basics of food needs. I think that our recommendations really align with many of the other papers as well that we produced for NITSCRAM. Obviously, there was an urgent need to remedy the unemployment insurance fund. Income shocks are significantly contributing to food poverty, and grant top-ups are likely to be much smaller than UIF or TERS payouts that people could get. We really need to think about continuing to expand the grant system through the COVID-19 Social Relief of Distress grant. I think what's really important is that one can have social relief efforts, and I think this was a key part of the lockdown response, because one needed to get food into households before one could get these programs of the expanded social grant system running, getting it running up and running, as well as it was really a stopgap measure also while the National School Nutrition Program was halted. But social relief efforts were only reported as getting to 18% of these individuals in these households. But social grants pre-crisis were reaching over 60% of individuals across the country, and 80% of individuals. So really it is the mechanism for getting quick emergency relief to households quickly, both presently and in the future. So this idea of just enrolling more people onto the system is a really effective way of getting emergency relief to households fast, and much more effective than trying to negotiate a system of food relief, which often does not work out in the same way and in the way one would want to. We've also suggested continuing the top-ups for 3 more months, and at least till there's very clear evidence of economic recovery, and that the indicators of hunger in households are declining, and that jobs are being, there's a labor reabsorption into the system. And then obviously improving the data to plan and track the demand for new qualifying grant applications clearly seems to be a potential concern. And with so many individuals reporting lost household income from non-grant receiving households and the poorest non-grant receiving households, this certainly does present some concern for the system. And are we prepared as a fiscus for these declines in household income and these shocks to jobs? And then with respect to social relief, really we cannot afford, if there's another lockdown of any nature and they have to shut schools, quite simply they cannot not keep the National School Nutrition Feeding Program going. If anything, the system needs to consider more nutritious meals, breakfasts, and thinking about funding for nutritious meals in early childhood development centres. We really reaffirm the value of the social relief efforts, philanthropy and NPOs and community-based organizations, faith-based organizations. They were working really hard during the lockdown. And we really are encouraging of the Department of Social Development to really start thinking about the 230,000 registered non-profit organizations as a potential source of support in the context of disasters such as what we faced. And we really need better information systems and local information systems to be able to use them better. A major challenge that emerged for individuals that were interviewed through in our key informant interviews, a major issue that arose was simply that there wasn't a register of needs to be able to support the provision of social relief to individuals. There's been little work to develop a register of needs, but it's evident from other contexts such as India that this is possible, that this can be done. And this could be done with support of non-profit organizations, community-based organizations, FBOs, for example, working with credible local leaders, and as well as partnering with schools and teachers who often know which children are the most vulnerable and in the most need of support. And then there is also there was also something that came out of our key informant interviews, was the need to draw on the disaster relief capacity that exists outside of government in other organizations that have been running for a very long time. There's much that can be learned from their skills, their operations, and their systems, and this really needs to be drawn on so that we can really engage and do disaster relief in the most effective way possible. We don't know what the future holds, and so preparing our state for situations like this is worth it. So that's my concluding slide. Thank you very much.